All right. So welcome, everyone. My name is Charles de Villeneuve, the CEO and co-founder of Link Senior. And I'd like to welcome you to the second session today with Sarah Thomas, Executive Strategist of Aging Innovation. Hi, Sarah. How are you? You're muted. Let me unmute you.
There we go. I got it.
Okay. Hi, Sarah. Nice.
Morning or afternoon in your world. Thanks for having me.
Yeah. Sarah's on the West Coast. So Sarah and I are going to be talking about a very important topic, which is hopefully a continuation of our first session today, which was the voices of activity directors with Dawn from NCAP and Alyssa from NAP. So Sarah and I are going to be discussing how COVID-19 broke resident engagement. So essentially kind of reset a lot of things that we did as activity and life enrichment directors. And where's the opportunity? Where can we rebuild? And how do we fix things so that the older adults, the residents living in senior living, can live the life and the experience that they deserve? So with that, I'm going to go through a few housekeeping elements for people who just joined us and for the recording, which is that today we will be providing up to 6 NAB, NCAP, and/or NCCDP-CU credits. To earn the credits, you need to attend the full session, so as few as 1 session, or as many as the 6 sessions, sorry. And you need to fill out the post-summit CU survey, which will be made available at the end of the day today, or by email. And so we'll send it to everyone by email at the end of the day today. You need to fill out this survey no later than midnight on Friday, June 26th, to receive the CU certificate. And these will be emailed to you by the end of the day on July 1st. I also wanted to share that the session is going to be recorded for future purposes, and they will be listed on our website. And I also want to share that we're using 2 platforms, Zoom and Facebook Live. You're more than welcome to be on both, but in order to receive credits for CEUs, you must be at least on the Zoom platform. About the Zoom platform, you might have realized that we've enabled both the chat and the Q&A feature. Now, given the very high number of people attending the sessions today, we will only be moderating the Q&A part. So again, there's the chat and the Q&A. If you want to ask questions to the presenters, so now me and Sarah, please do that in the Q&A section. And then last but not least, if you are playing the bingo game that we started, the word for the session is believe. So the bingo word for this particular session right now is believe. So without further ado, I'd love to introduce Sarah Thomas, my co-presenter today, and she is the Executive Strategist in Aging Innovation. And myself, my name is Charles de Villeneuve, and I'm the CEO and co-founder of Link Senior. And I'm going to now switch to the slides for this presentation. All right. So as we heard from Alice and Dawn previously about the voices of the activity and life enrichment, I think it's important, as COVID-19 impacted our work now several months ago, that we pause and we think about how it's impacted our work, how it's limiting our ability to engage the older adult or residents, and what we do about that. So with that, I wanted to explain to you what Sarah and I were thinking in terms of presentation. Essentially, we wanted to take a deeper dive in exactly the exact impact of COVID-19 on resident engagement. So I will be doing this session as an introduction. Then Sarah and I will be discussing how we are currently reopening as the country reopens, as the market reopens. What does that mean in terms of impact for resident engagement per se? And then Sarah will share some of her expertise in helping us define what are the opportunities in front of us and how can we grab these opportunities to define our new normal. Sarah, did you want to share any thoughts before I get started?
No, let's dig in.
Let's dig in. Thanks a lot. So, as I mentioned, let's take a little look of how it's impacting resident engagement. So, I think the most important to start on a good foot is really to think about one, what is resident engagement? So we still get that question quite a lot. Take a dive into what broke, right? What essentially can we do right now that is profoundly needed for the well-being of our residents, and what is staying. So if you take a step back and resounding on some of the insights that Alissa and Dawn shared in the previous session, activities and life enrichment are essential professionals, right? If you think at the concept of the social determinants of health, we know that anything that is psychosocial, that is life engagement, has the impact of, can have the potential impact of 70% or more of the outcomes of the people we serve, right? Which is a tremendous impact and tremendous potential. And it's interesting to think about the fact that our activity directors, our life enrichment directors, have the potential of impacting the quality of life of residents to up to 70%. Now, what does that mean when we think about older adults and individuals who are losing or cannot self-recreate anymore? And I think that the best way to explain that, to put resident engagement in this context, is to take a quote from Abraham Maslow. And some of you might have seen this slide before. It's one of my favorite when it comes to defining resident engagement, which is that a musician must make music, an artist must paint, a poet must write. If he is to be ultimately at peace with himself, what a man can be, he must be, right? And so in the context of people losing or having lost some element of self-recreation, how can that impact our work, and what does it mean for senior living, right? That is a great way to help us define that we are basically agents and here to help bring purpose to the residents that we serve.
Yeah, Charles, I'll just chime in there. And as an occupational therapist by background, I really drive home the whole idea of finding meaningful engagement and purposeful activities. And we're really driven as human beings for that. And so we have a great opportunity right now in this time, while our eyes are wide open, really to take a look at how we create better experiences, better space design, better process redesign, to really allow for self-actualization. So I love this quote. Thanks for sharing, Charles.
Thanks, Sarah. So engagement, again, like Sarah was saying, is this immense opportunity in front of us. But what is preventing us to reap the benefits from it? And I think it's important to really step by step look at the impact. And so I want to thank everyone that's contributed to some of our research that we've been doing through these webinars and other avenues. And we've published this white paper a couple of weeks ago that essentially shows, from a data perspective, what is the impact on resident engagement. So as you can see, and as we all know, because of COVID-19, our outside help is extremely limited. We cannot do groups anymore, like physical distancing is really limiting our ability to be efficient through groups. and we have less time as activities and life enrichment are often pulled in different directions. So if we are to measure the impact, it is pretty saddening to see that if we were to try to do the same type of quality as before, we need to find, on a monthly basis, we need to find between 140 hours to up to 124 hours per month in terms of staffing. And as it was shared on the previous session, it is actually unlikely that we'll be hiring for these particular departments in the coming months. So essentially, how do we think about that, right? How has that broken our ability to help residents live with purpose? And I think that the other aspect to this, which is very kind of saddening and in a way scaring, is the fact that most of us are reporting that we can't do enough one-on-ones, right? So if we consider the fact that in assisted living, in memory care, and in nursing homes, a good portion and sometimes the bulk of our residents need this personal engagement, how do we do that? And as I was preparing this session with Sarah, one of the things that she shared with me is that today, the only known is the fact that there are so many unknowns, right? And as we navigate these challenges, how can we best respond to them, take the data, and make informed decisions? I think that one of the things that stays also is the core of activities and the core of life enrichment, which is essentially our promise to our residents, right? And our promise to our residents is that we will collaborate with them so they can live with purpose, right? All the rest can potentially, in a good way, hopefully, be disrupted, right? We talked about activity calendars in the previous session. We talked about having scheduled activities. How can we, in a way, disrupt that to the benefit of our profession and to the benefit of our residents? So with that, I'd love to take us to the next session and hear from Sarah how, as the country is reopening, how can we reopen resident engagement and build from there?
Great, thank you, Charles.
Sarah, can you see my slides? Yeah.
Yes. So, you know, we have a lot to learn. We've all just been learning and growing so much in the past few months. But if you take a look at what's happened to the essential environments, you know, ours being one of them, but also the retail environments and those, you know, like restaurants are starting to reopen, grocery stores have been open. What were deemed in the very first stages as essential, we had to adapt very quickly to the space redesign and process redesign that was necessary to keep people safe. And we can, you know, look to see what people have done. So one directional aisles at the grocery stores and keeping people socially distant, encouraging hand washing and cleaning your hands on the way in, temperature checks, as well as face masks. One thing I think is really important as we begin the rest of this conversation, and as also we begin to reopen resident engagement, is to remind our residents and ourselves, because I think we need the reminder that we're not alone in this. It's not happening to them. It's really with everybody in society. We are all changing our behaviors every day. We're finding new ways to engage with one another. We're finding ways to experience the same spaces that we used to go to every day in a much different capacity, in a new way. And this is something we're all involved with. And I think that it's really important that it's not just senior housing, it's not senior care, it's not happening just to seniors or older adults. It's really happening to society as a whole, and we're seeing that we all need to change for the safety of ourselves and those around us. So this is just an example of some of the space design that we see with the essential environments on the very first days. So this is another example. It's really hard sometimes to be understanding that face mask is so important to create a safer environment for those around us, to protect ourselves and to protect others, while some people may not understand or believe in the capacity of that action. So we need to also see what people are doing to create space that really allows for these practices, these best practices, to be installed in a way that doesn't require social awkwardness, where we're debating with each other if this is the right thing to do. So if we're looking, as this is an example, these pathways are designed so that people just naturally fall into social distancing without causing disruption between the two people who have to then debate if that's the right thing to do or not. I think taking some of these guidelines, the CDC guidelines, the local recommendations, and the health expert recommendations, and creating space so that it just allows for community engagement, but also containment, and also for the best practices to be implemented, is something we can learn from the phases of reopening around the world. And we've all mastered a changing work environment where many of us have had to take our morning meetings and move them to virtual. We certainly, we have 1,500 people on the call right now, taking summits and conferences and making them virtual. But we've learned to do this in a way that really connects individuals, allows resource access, allows socialization and a feeling of connection to others, personalizing it in many ways. And we are bringing that into our homes, into our lives, into our work environments. The work environments have had to adapt, and we can certainly do that in each of the communities that we serve as well. I think, as each industry reopens and finds ways to adapt to some of these new guidelines and the new situation that we've all been faced with during COVID, and that we continue to be faced with, we find that we can actually do a lot from the comforts of our own home. And open houses have gone virtual. You can actually buy a home right to close, all virtual, with virtual notaries that can actually handle all of this in each environment without you having to be fully immersed with others, with large groups, going from place to place, increasing your exposure, increasing your risk. I think some of these examples are important to bring back from other industries to ours, so that people are realizing that they're not alone, and it's not just the activities that they're used to doing have changed because of something superimposed on them. There's opportunities now to engage in things that are more efficiently done through use of technology. If we haven't learned that technology is now essential, I think we certainly need to adopt that practice, but there are ways to do many things now that we couldn't have done before, because we're adapting each industry and each practice in a way that's now tech enabled and tech enhanced. Again, with the other industries, we're seeing the process redesign, for instance, as we see restaurants open back up. We might have to change the capacity. We may have to reduce how many people are in the same space. We may have to look at reservation systems and the flow of the individuals, who's sitting at the tables together, how are we allowing for the social distance practices, how are we allowing for a better space redesign similar to what the restaurants are doing. And we can adopt this into our own dining practices as well. And the restaurant industry has done this. There's multiple examples of this, but how are we creating green space in between and walking paths in between? How are we allowing for safety of the workers, making sure that they're masked and that they are also enabled to keep their own safety and maintain their own distance as much as possible from the consumers that they're serving. So as we see restaurants open up, my family's on the East Coast, I'm on the West Coast, so we have been hit pretty hard, as many of you I know are as well. But other states have opened up, and they're also learning the hard way that when you don't implement some of these practices, increased risk. So we want to make sure that we're looking at how people are doing this safely for the other industries as well.
Thanks, Sarah. Just let me know when you want me to change the slides.
Okay, sure. Next slide, please. So I want to show this too. I think it's really important. This is restaurant service again, but we have a lot of hospitality that we need to really pay attention to. How are we allowing for people who are walking by to maintain their safety, those who are working maintain their safety, while also create a sense of community and still have really meaningful engagement in the activities that we wanted to. Go outside, be with people, enjoy a meal, share an experience, share an outdoor space, and how can we do that safely? I would like to say, even just beyond the restaurant industry, looking at brands and companies like Lululemon, for instance, if you look at the retail side of things, brands that have already had flexibility of space design. And if you look at any of the Lululemon stores, each of them are a little bit different, but with the same branding and flair. And that's because they allow for community engagement at a local level. So some will have yoga classes or running classes, or they'll running meetup groups, or some sort of in-store experience that allows for community. And this was pre-COVID. But by allowing for flexible space design, really immersive experience, and a community and a sense of community that extends beyond the brand, and then allows for community engagement at a digital level beyond the store, beyond the brick and mortar. We have a lot to learn from that, because they've weathered this storm, pretty well, because of the experience and the space and the mindfulness around basing community and extending beyond the walls. So we have opportunity now for us to do that, if we haven't already, to really create brand that moves beyond the walls and allows for really experience flexibility and space flexibility. Next slide, please. And I think we've seen some, creative approaches to this as well. These greenhouse models, we're looking again at creating kind of that in a unique way that allows for that safety and allows for compartmentalization so that we can continue with cleaning. And we're seeing, other industries do this, like the restaurant industry, but we're really able to kind of extend that into our own communities as well. Next slide, please. Charles.
So I think there's a slight delay with your connection. Yeah, do you want to, there's a slight delay. Can you see the slide change?
Yeah, no, it did. Yes, thank you. So we're, I think looking at design differently as well. When we've had to adapt. We're all adapting, and we've, I think, done a lot already. But if we're creating either new builds or renovations, really looking that this isn't just a temporary thing. We do want to be more mindful of how are we creating space that allows for distance, and that we're not stuck in this position again where we may not be prepared, and how are we allowing for still engagement in these activities we want. So this is a great example. They've created these walking paths. It's a design coming out of Austria that basically allows for people to continue with their walking paths without being so close to one another, still enjoying nature, and still keeping their space and distance from one another. Next slide, please. I think that this is in New York, and I think that we're seeing those who are really affected. We're all just tired of staying inside. We're tired of doing the same thing with the same people. We're ready to get rid of our families and trade them in. I think that we're all in the same boat. I think we need to remember that. But as we're looking to open our own spaces back up, creating that distance and that space is important for each other, and not everybody's going to have the same beliefs. But again, I think it's important to take a look at how we allow for community, allow for some of these activities to reopen, and allow for people to be outdoors, but in a safe space. And I think by really delineating the space and looking at how we're creating opportunities to stay socially distanced, similar to how this park has done. It just is a natural way for people to engage with it without questioning one another, and we can do this in our own communities as well. Next slide, please. Perfect. So, we've talked about other industries. These are communities with Juniper, and I think that it's a great opportunity to see what we've done to adapt. We've had virtual visits for our residents. We've had window visits. We've had grandchildren being introduced to their loved ones through the windows. New family pets. I mean, a lot of people have received puppies these last 3 months. And there's lots of ways that we've adapted in the current framework, and I think that it's going to be really important to see how we design things moving forward. Next slide, please. We've also had to adapt on how we are approaching our staff and our employees. This is another community at Juniper. Really look to see how are we creating cohorts, how are we keeping people safe within groups and clustering of employee engagement. If someone is positive, how are we helping them to stay isolated? These are RVs on the campus so that people could actually stay, reducing their own risk, reducing their own exposure, but also reducing the risk to their families. And should someone need to be isolated for testing positive, allowing for adaptable home space and isolation if necessary. So I think that we've shown resilience in the industry. I think we've shown that we also have responded. And I know Charles will speak to some of what this new norm is that we've been learning while we're adapting during COVID. And I'm excited to see what we have ahead in the months to come. And we've also certainly seen lots of car parades celebrating birthdays and Mother's Day and celebrations. I think we're still going to need some of this distancing, but it's been exciting to see how people adapted. And again, we're doing this currently, but I think that some of this is here to stay, and it's allowing for kind of greater connection into the community. We've also seen industries, that have had to close it for public consumption and taken them virtually. So we now have museum tours and zoo tours, experiences that are all virtual, and we've seen this during COVID. And we certainly, I think, have adapted to the use and need for technology to be able to access some of these great resources.
Thanks so much, Sarah.
Yeah.
It's exciting as Sarah was sharing, she works with Juniper right now, and we've seen across the market, the senior living industry and the long-term care industry as well, incredible resiliency and like creativity all about. I love to see these different parallel with other industries because, there was this quote that was saying that the future isn't so far, it's actually already here. You just need to look in different places. And sometimes by drawing what other industries are doing, it helps us innovate faster and in a more relevant way, which is, again, as we think about the title of this slide, of this presentation and the potential that we have in front of us, is how do we use this amazing opportunity in front of us? I know it's challenging. Like we shared at the very beginning of this summit, through these few moments of silence, everyone has gone through some kind of loss, and our residents as well. But with these challenges come immense opportunity. And I was reading this article 2 days ago that helped us, in a way, put things in perspective, which is that this age wave that we've been talking about for a few years now is still coming, right? It's in a year or two, but as this age wave approaches us, right now is actually a fantastic opportunity to think about how can we innovate. And right now, through any type of crisis, we know that right now is the moment to use that, right? To take this power we have and the responsibility we have to define how we will be working tomorrow. So I'd like to share a few thoughts with you about what we're seeing from a data perspective. But before that, I'd love to do a little game with you, which is I'm going to share with you an image on the next slide. And I'd love you, any one of you, to put on the chat or on the Q&A what you think or what you feel about what I'm about to show you. And I'll expand from there. So on the 1, 2, 3, please tell me how you feel when I show you this particular image, this slide, right? So obviously, this is an activity calendar, right? And in a way, good or bad, in a way, shows how we operated before COVID-19, right? A lot of us, and it is great, a lot of us were very good to plan. We love planning days and weeks and months ahead. But I think that for us, the biggest lesson about COVID-19, and Don actually mentioned that in the previous session, is that, and actually Alice as well, is that we need to be as flexible as possible right now. And the opportunity for us is to really think about the needs the need and the well-being of our residents. And sometimes, especially when we think about assisted living, memory care, or long-term care residents, these individuals live in the moment. And so as far as we want to plan things ahead, sometimes again, days and weeks and months, it is important to think about what do residents need right now and how can we engage them so that they can live with purpose. I think there's a lot that has been said and will continue to be said about, how much are we going to be planning in the month ahead? I know that we did a survey on one of our last webinars, and 94% of you mentioned the fact that your activity calendar had changed or changed tremendously. I'd love to talk to the 6% of you that say that the activity calendar hasn't changed, but still, I think that it speaks to how much our discipline has been, again, kind of disruptive, but also talks about the potential. So let's talk quickly about the potential and how we think about rebuilding, how we think about fixing. And I think that at Link Senior, we've been promoting 3 main ideas that are, again, simple, and for a lot of you, you've already been doing some of these through COVID-19, which is, 1, the first idea, and I think that throughout the surveys that we've seen and the question we had earlier, but we still get them, is how essential the staff is. The staff that works in activity and life enrichment is essential. And not only for the well-being of our residents, but for the whole operation of senior living and long-term care. The other aspect is that we need to increase the education available to the staff and how it's delivered and its frequency and its opportunities. So with that, we're very excited about the different opportunities from NAP and NCAP, but we believe that the more educated the staff is, the better resident engagement will rebuild. And I think that with that, we need to think about how can we increase department budgets and digital technology, as we need staff to be empowered and flexible. With that, the second type of lessons learned, I want to say so far with resident engagement, is we have to go back to basic. There's no other options right now. We have to think about how can we make sure that every resident is engaged with purpose. And with that, we will continue having calendars, which are great for planning purposes, but that should never get in the way of us checking in with every single resident and making sure that we are empowered to have at least the bare bone minimum in terms of one-on-one and room visits, right? So that leads to the third part of going back to the basic, and we've had a lot of questions when we look at our data, which is, before we did activity calendars with 1 hour slots. How important is that? And it's been proven on and on and on in research. It's actually proven in our data and through the interviews that we've been doing, is that our focus as activity and life enrichment professionals is really to focus on quality versus quantity, right? As we know, some people that live with dementia, sometimes they cannot go through more than 10 or 11 minutes of engagement, right? It is probably better to do hand massage activities that could last 5 minutes instead of having hour-long programming like we might have had before. So the opportunity here is to really think about, and it's always the one truth about resident engagement, is resident first, the person first, right? How can we enable that? And there's 3 simple questions to help us navigate that, which is, 1, are we engaging everyone, right? And if we're not, what's preventing us to doing that? The second question, kind of a little bit what resonated in my last comment, is, are we engaging people based on their needs and preferences and who they are, their source of purpose? And ultimately, are we thinking about maximizing well-being and outcomes? Which leads me to the third aspect, the third kind of lessons learned, is in this world of limited resources, limited staff, right? How can we focus on efficiency? And I think that we will all agree that activity directors, one of the things that we're not very good at initially is time management and thinking about the return on investment when it comes to certain types of activities. And I can tell you that it's shown in research and also shown in our data that if you were to prioritize the different types of programming, the type of programming that has the highest impact in terms of not too much research and preparation, but the biggest reach in terms of numbers and cognitive abilities of our residents, cognitive potential, is music, right? And I think we've all seen some of the Alive Inside movies. We've all experienced ourselves the power of music. If you were to think about return on investment, music is fantastic. Reminiscing comes next, and then games. Anything that has some competitiveness to it and or social interaction. I think it's also very important to manage lists and help our staff, our team, making sure that every resident is engaged. And as I shared before, and actually Alistair had a comment about the fact that CMS viewed the universal worker as a solution right now. We don't have the choice anymore. We have to seek the help of other departments. There is no question that in order to be successful, in order to rebuild activities, the activity director needs to be the CEO, the Chief Engagement Officer, and needs to lead with other departments how each resident is engaged. And this is all about interdisciplinary work. And an organization will be successful if they think about every staff member is a potential activity or engagement assistant, and so on and so on. So it's very important to think about any person, any interaction is an opportunity for engagement. We're very passionate about trying to see how things are going to evolve at Link Senior. And back in January, I actually held a webinar about how we think that resident engagement is going to be measured. And to be honest, it hasn't changed much. I think that COVID-19 in a lot of ways highlights the need for more activities and more resident engagement. And I think that as we continue navigating these challenges as the country reopens and our industry reopens, we will see how can we support and measure staff, how can we use how we can have the appropriate use of one-on-one and intervention, and how can we make sure that 85% or more of our residents are engaged. So together we look at how resident engagement was quote unquote broken in a good way by COVID-19 and how we are reopening. Sarah, I'd love to hear from you what are the different types of wish lists and how we can rebuild this new normal.
Great, thanks, Charles. I think, I'm also seeing just so many great ideas come up on the chat. Everybody has, done a great job of adapting in these difficult times, and also being creative around what's staying and what's working, what's not working. So I'd love to leave a few minutes for questions as well. So let's go through these, fairly quickly. Some of them are reminding us that the things that we learned from other industries, the things that we're doing during COVID, are some of them are here to stay. Some of them are not. I don't think, this Getty Images did a great job of featuring this because it's, it's creative in a time of emergency, but it's certainly not how we should move forward. I don't think we're putting plastic bags over our heads or tarps in between us and thinking that that's going to engage us in a way for the long term. I think we can do better than this. But it does show that people are craving human connection. People are craving touch. People are craving community and seeing loved ones face to face. And we need to find progressive ways to make that happen, and ways to be able to engage with one another in an emotionally connected way. And while virtual is wonderful, it may not be the only way. So let's look at some of the options that I think that are here to stay. Next slide, please. So I think we need to start doing more of this. We can not just take one individual out for a walk on a path, which I've been hearing a lot of communities doing. I think we can create opportunities for sharing of space and sharing of experience. We just need to think about the design a little bit better. Next slide, please. So, some of the designs are not just temporary or not just plastic. We're looking at people create things that can be here to stay. Similar to this example for Thrive, putting dividers up so people can actually have conversation, quite close to one another, but with a safety and mechanism in place, with a barrier in place. And what I love is that this design is public. People are saying, here, make this. We've designed this. We love this. Please, you can purchase this from us, or you can make it yourselves. Let's open up these resources and opportunities and options to one another. Next slide. I think looking at the infrastructure and the space, allowing people to see one another and also feel a sense of being together, even if there needs to be some sort of safety in place or barrier in place, allowing for speakers within each room, within both rooms that are allowing us to talk to one another, hear each other's voice, see each other without touch right now. But certainly opening up space beyond that physical isolation, beyond that social isolation, and allowing people to engage in quite similar ways. We've all had a virtual happy hour or virtual coffee hour, shared a meal with one another over a screen. Can we get one step closer? Can we allow for some of these designs that we're implementing to allow for us to be together, even if we have these design restrictions? Next slide. Another thing that is really here to stay, I think, is creating virtual community. And Peloton's a great example. Peloton has absolutely crushed it these last few months because people couldn't get to their gyms. So the home workout environment, we all know if we don't partake in it, we're at least watching others partake in it on Facebook and others. Everybody's following their own exercise regime. But beyond that, I think looking at the trend that Peloton created around creating that virtual community, that virtual connection to others, the leaderboard, the time of day you're joining, that people from all across the country or all across the world getting into your routine together at the same time, and creating virtual communities. I think this is also how we extend our brands, allow people beyond our walls to enjoy activities together, how families can engage, how peers can engage. And this is every age, and we're seeing it in our own lives. There's no reason why we shouldn't be creating this for others in the communities that we serve as well. Next slide, please. And I think we have virtual visits for socialization, but having telehealth practice increase is tremendously valuable for all of us. I've been involved in telehealth for a very long time. I'm speaking again for the 5th year at American Telemedicine Association, their annual conference this week. And what we really need to see is that telehealth is here. Telehealth is here to stay and has such great value because there's no need to put us at greater risk going to doctor's offices, going to hospitals for basic routine checkups, or even for that first level triage, the assessment that can happen virtually, increasing resource access and efficiency and effectiveness of the care that we can deliver, while reducing risk to exposure. Also, just the challenges of mobility and transportation and some of these other challenges that we all have, even just the inconvenience. And now we have the accessibility of telehealth into our homes to do that first level of care and allow for much of the in-person hands-on care to be delivered in a more effective way when it is necessary, but allowing access to telehealth and telemedicine is really vital for us as a society and also in the communities that we serve. Next slide. And virtual reality has allowed for us to go places we've never been before, or return home to homes that we once lived in through some of the tours and the visits, being active, more active than we physically are on a given day, if we have some sort of physical limitation or a momentary change in our routine, so we can't go out and do as much activity. Right now during COVID is a great time to virtually immerse ourselves in an environment where we can have engagement and movement, also socialization, connecting with others. Virtual reality has shown us that over the years, but right now has, through necessity in some ways and through opportunity in others, just shown us the opportunities that we have. Companies like Rendeavor really showing us that we can truly engage our individuals and also as groups with reminiscent therapy and also physical activities. So it's a wonderful addition if you haven't added VR to your communities. Next slide, please. I think that we've been doing this independently and alone. We're looking at some other, other resources. Salesforce has come in and offered, great resources that didn't exist for us before in our industry. Our REITs are stepping up. LTC REIT, worked with Juniper to create this virtual connections platform available to everyone, allowing for lifelong learning, having not only just physical activity like Otago exercises that are online that you're able to access on demand, but allowing flexibility of scheduling for the individual to take classes, to do to access resources. And Charles, you mentioned really allowing for flexibility, and we had that really awful calendar that you showed, and I was looking at the chat and almost everyone felt overwhelmed. I mean, a couple other things like sad or this has got to go, but really overwhelmed. And where do I have to be when? And both staff and residents feel that way. And how, what does that calendar look like when it's so fixed, and how are we delivering it? Not that it didn't have value, but we really have opportunity to reevaluate that and determine when and how do we want to engage in these meaningful activities, and what drives purpose for us. And is it something that is on a calendar, or is it something just available to us when we want? And looking at virtual connections like this that allow us to access so many things at our fingertips at the time that we want it to, and that in a way that is meaningful for us. Next slide, please. I think we're also looking at going back in time and what served us before, what was exciting before. Drive-in movie theaters are taking off, and the ability now with so many different mobile projectors and screens that we could all create movie theaters, drive-ins, allow families to come visit in their car, allow that social lawn spacing and outdoor theater. The concerts, we've seen many on the chat today, concerts outdoors while people are on their balconies, and it may be a different setup, but we're still allowed to bring music, bring theater, bring activities in real time that people are engaging in a way that's also distance and safe, compartmentalized, but creating community. And I think voice first is also something to really consider. I don't know how many of you talk to someone in your house. I call them someones, but I have Alexas and Google Homes, and oops, she's going to talk to me now that I said her name. But I have lots of things where I ask the time and I ask the weather, and I at least do the minimal. And I find myself when I travel, which I used to do a lot, travel for about 75% of the time for work, and I would be in a hotel room and be asking my people, and the people aren't answering. You become used to having these technology tools that are voice first, asking for different resources, ordering my Lyft or Uber, ordering Instacart, reordering my Amazon, really adding resources to my voice, and there is a sense of connection there. And I almost feel neglected by my virtual assistants when I'm in a place that doesn't have them. And I think we're realizing that voice first can have a place in our communities as well, and also create a sense of connection to resources. We can call our loved ones, the loved ones can drop in, we can have our virtual meetings with people, we can order our meals, we can order someone to come and fix something if we need a maintenance repair. I think voice first is a little bit eye-opening during this time, and also being able to keep that moving forward, and the momentum as we reopen will be exciting. Next slide, please. And while, people want to return to some of the routines and the activities that they were, and maybe the home gym in a small apartment isn't working out, they really want to get back to their own routine. This is an example of allowing for both, allowing for, some of that personalization and safety within a very unique space to them, while also allowing sense of community, change of location and change of atmosphere. And we are going to have to look at how we're doing this. It's not temporary. This is how we're looking at just how we're designing space, experience, and community moving forward. Thank you, Charles.
Thanks so much, Sarah. This was a lot of ideas in a short amount of time, but they were, I find it really, in a way, exciting to hear these concepts and what you've been seeing. So, you mentioned several times, this idea of wellness and how can we recreate. What are the things that you've been seeing when we consider the fact that we have this well-being model, right? The different dimensions of wellness, mind, body, spirit. How is that going to be revamped, especially when it comes to assisted living or maybe memory care? Have you seen anything successful or any models that ideas that you like?
Thank you, Charles. I think a lot of these themes that we've just talked about and examples we've talked about help us to fulfill that kind of mission that we should all be on, around looking at all dimensions of wellness and well-being, and enhancing that in a more comprehensive way. So how are we keeping people cognitively stimulated and cognitively engaged? What activities are we bringing to them, or levels of engagement are we offering them that keep them thinking, learning, growing? Then physically and physical movement, how are we creating an environment where they're at home and safe with virtual exercise, virtual activities, but also create that sense of community, similar to the Peloton theory, looking at that sense of comparison to one another and our own goal setting potentially, but our engagement with one another around progress made, and also gamify this a bit. How are we all participating in our own goal attainment? How are we taking something very personal, very meaningful to ourselves, but connecting it to a greater community, sharing results, and really allowing that sense of well-being, definitely is still driven from sense of personal meaning, and that self-fulfillment and self-actualization still has that element of family connection, community connection. So you mentioned music. If you're looking in memory care, connecting music with one another. It still should be appropriate to the cognitive level and physical capabilities of the individual, but as a group can still connect in ways that allow for fostering community, as well as personal development, and then and really programming around all dimensions of wellness. You know, I think a lot of people have reacted bringing single iPads into someone's room or tablets into someone's room and home, and allowing them to call their loved one and checking a box and saying, okay, I had an activity today. I think those were the first days of our activity engagement of COVID, and I think they were fine for the first days. People are trying, but I really am happy over the few months that that's grown a little bit more creative and a little bit more purpose driven, and now I think we need to move that needle even more for that whole element of all dimensions of wellness and well-being.
Yeah, thanks, Sarah. You know, it reminds me of something that I think is extremely important, especially when our resources or what we can do is reduced, which is that, you know, and sometimes we get that question, right? Is it better to do when we think about creating a program for someone, especially if they have cognitive impairment? Is it better to think about their ability or where they stand in terms of cognitive journey, or their preferences, right? And we know by research and actually some of our data that by far the most important is to start with the person, their preferences, and then to build and then readjust. I know that you, from with your background as a therapist, you can speak a lot to that, but anything you'd like to share about that particular comment?
Oh, I could tell you stories. Yeah, I mean, we know that things that can tap into individuals' sense of self and historical memory, and things that really define them, songs that tap into childhood, or things that, you know, I had a music teacher once who would never take a shower, would never allow anybody to touch them and care for them, and became really combative. And you know, one of my first patients I ever treated, residents I ever treated as an OT, was bringing a keyboard into this individual's room and allowing her to play the piano. They had no idea she still could play the piano because they couldn't get in beyond that wall of dementia, but they were able to unlock a skill and a talent that had been just so, she was a music teacher for years. It was something that was still there. And now if you calm her and are able to connect her in through something meaningful to her first, you know, she's nonverbal, but she could still play the piano. You calm her in a way that now she accepts care. Individuals are coming in and able to continue the routine that is necessary for her. But you're right, we have to look at the individual, tap into the things that drive them, the memories, and then move forward with, you know, cognitively stimulating memory and improving and engaging activities.
Thanks so much, Sarah. With that, I wanted to thank you. Yeah, thank you again for working with me on this presentation and being with us today. It's been exciting to see how things evolve, and I think it's exciting to see where our opportunities lie and how we can redefine resident engagement. I just noticed, everyone, and Sarah, I apologize, that your email isn't spelled correctly. It doesn't have the C at the beginning, so I'm going to fix that, and it will be, I'm sorry. So with that, I wanted to conclude this second session of our virtual summit, Activity Strong Virtual Summit. I'm going to stop the recording, and